Good evening, everyone, and welcome to another Building Better Business Practice Management webinar series. Tonight's topic is Insurance Billing 101 with MorI West. So for those of you that don't know me, my name is Natalia Morrison, and I'm the Director of Communications for FISOMA. And I am so excited to be able to bring for you guys tonight's free webinar. MorI West is a nationally recognized expert in insurance billing for acupuncturists like you and me. And we are just so honored to be able to have this 1 hour with her where you guys can also pick her brain and ask her your questions. Now, we also are going to be doing something really exciting with MorI in the middle of July, so July 18th and 19th. We're going to have her back here in FISOMA, and we're going to do a 2-day weekend webinar on insurance. And MorI will talk a little bit more about that. And those of you that have learned from her or have heard of her, you know that these are 2 classes not to be missed. So before we start, let's make sure we have some, you get to know us. We're in the chat box. If you're joining us through Zoom, at the bottom of your screen, there is a chat icon. And if you just tap that icon, go ahead and type in where you're at right now. So I'm in Miami, Florida. And MorI, where are you talking to us from?
I'm in Torrance, California, so I'll put Torrance here.
Torrance, California, nice. Oh, wow. We have Seminole, Florida, Phoenix, Arizona, Delray Beach, Fort Pierce, Jacksonville, Sarasota, Hollywood. They're coming in so fast.
Yeah.
Hawthorne, Tampa, Hollywood. Awesome, Weston, Lauren, hey. Thank you everyone for joining us. And also there is a Q&A icon at the bottom of your screen. So any questions that you have for tonight, type them in the Q&A icon. And you have the ability to view your colleagues' questions and you can upvote it. And that allows it to go up the queue to make sure that those are one of the first few questions that we go through with MorI. And for those of you that are joining us on Facebook, hi, welcome. And thank you for being here. And thank you, everyone. So without further ado, I know you're not here to see me talk. You're here for MorI. So hi, MorI. Thank you for being here.
It's my pleasure. So right now I'm going to share my screen and I'll get started. Okay. So we're going to talk about Billing 101. This isn't a complete, this is an overview. Complete will happen that weekend on Saturday when we'll do all about insurance billing, and then Sunday we'll talk about documentation because they really go hand in hand. It's really important that you understand both. So I'm not able to change. Let's see if this happens. Oh, there we go. Let's go back. There's our disclaimer. Just understand that this is my area of expertise. However, sometimes the information that I present gets translated slightly different. If you've never done any insurance billing, the first time you hear it, it can be a little bit confusing. So just understand that I'm not responsible for any errors in terms of understanding. So we have to start with the basics. So it's just really important that you understand that there's going to be some paperwork involved. There's going to be some business basics. I know why you became acupuncturists. You're healers, and we don't want to change that. I don't want to change any aspect of what you do for your patients. I just want you to be able to bill insurance if that's what you want to do and get reimbursed that way. So I want you to know that the basics are pretty much the same for all types of providers. You're going to have to acknowledge them. There's some basic paperwork that I want to go over so that you have an understanding of why you have this patient sign this form, or why it's important that I keep this in the patient's records. We're going to talk about coding, and everybody gets so, ICD-10 sounds a little like something, but it's this international classification of diseases, and CPT is just common procedural terminology. It isn't rocket science, but people, when the time they get to codes, they go, oh. I'm a certified professional coder with the American Academy of Professional Coding, and I'm going to tell you that there's lots more codes. I mean, there's a book on these codes, and we're just going to talk about the few that have to deal with the type of practice that you have, and then we'll put it all together. So when you put this on your website, this office accepts insurance, or you've got it on some advertising, or you let it be known on your website and in your business cards, we accept insurance. What expectation are you giving your patients? Think about this. And it's a real simple answer. It's a super simple answer. They expect that you know what you're doing. And this is what makes me sad, is because I see a really great healer, someone that their skills are superb, but when they don't meet the expectations of their patients by saying, I accept insurance, but then the insurance never reimburses the patient, what does the patient do? If he really wants to use his insurance, he goes someplace else. And that person might not be that great healer that you are, but you have to meet patients' expectations, or even better, go beyond. Under promise and over deliver. Whenever you can do that, when you say we'll accept your insurance and you understand it, they're going to be more comfortable with you. But when you say we accept insurance and you're a great healer, but they end up getting something in the mail that says, oh, there's a mistake with your claim and we're not going to pay it, in the patient's eyes, you haven't met their expectation. So it's really important, if you're going to say these words, be prepared to meet the expectations of your patients and understand how the insurance works. I have a lot of people that think that the insurance company or billing services should train you on how to do billing. And insurance companies, they're not as bad as you want to think. Some people say, oh, insurance, they just want to screw acupuncturists. Make no mistake, they're not there to help you, but you're going to get screwed if you don't understand the process. And it isn't their fault. It really isn't. So we want to meet or exceed patients' expectations when it comes to their insurance billing. So how do you do that? You do that with policies. Policies confirm expectations. When you say something, have you ever said something to somebody and then you come back a week later and they heard it totally different? That's because it was verbal. So policies are written, and they're written for a reason. So you can confirm expectations about how much they're going to pay, when they're going to pay, what you're going to do. And you really want to be clear about this. This is so important in practice management. All well-run practices have agreements that they provide, policies that they provide their patients, telling them what they will and will not do. And by putting the policies in writing, you make sure and establish expectations for both sides. And this was very important. When I was an office manager for years and years, when it came to that, the policy on what our expectations were, our financial policies and patient responsibilities and provider responsibilities, I would sit with the patient and ask them, do you have any questions? Now, why did I do that? It was to make that conversation memorable. I didn't want them to go back and say, oh, that was just a whole bunch of paperwork you had me sign. They're not going to forget. Here are our office policies. Do you have any questions about them? I just want to make you aware. If you can get in the habit of doing this, I'm going to tell you, you're going to stop a lot of problems down the line when it comes to financial issues. Because what happens is when the insurance company doesn't pay, a lot of times you think, well, I can't go back to the patient and get them to pay. And in some cases, it wasn't your fault. The insurance company told you the patient had coverage, and then come to find out later he didn't for whatever reason. It's not your responsibility to just eat it. You confirm with a patient, if for any reason your insurance doesn't pay, you will be ultimately responsible, and they remember that, and it's memorable, and boom, then you move on. Because if you don't do it in the beginning, I'm telling you right now, at some point in time with some of your patients, you're going to have that hard conversation and talk about money. Why not do it in the very beginning and get it over with? Now we're done. So big mistake number one, I'm going to talk about 5 different mistakes. Frankly, I made some of these when I was an office manager too. And so you can learn from somebody else's mistakes and you don't have to make them. Not having clear-cut written policies about various aspects of your business. This is just so important. What happens if the insurance company doesn't pay? They're ultimately responsible. Now here's a big one. What happens if the insurance company needs more information from the patient? I can't tell you how many times we've waited for payment from a carrier and that the payment is being held up because the patient didn't fill out a questionnaire or didn't come back to the carrier and give him additional information. So that should be in your policies. If the insurance company requires additional information, you will provide it. Otherwise, we're going to have to charge you, and then you can work with the insurance company to get reimbursed. This is just very important, and we see this happen. It's not as frequent. They don't make that denial too often, but I've seen it with pretty much every office I've ever billed for at one time or another. We've got over 150 right now we're billing for. One time and another, they're going to get something that says we need more information from the patient. Does he have some other type of insurance? Or has he moved recently? They just want to check in, and they're not going to pay you unless the patient provides that information. And then I've had lazy patients that didn't do it. And so we're waiting for money that why should we have to wait for when they've signed a financial agreement that said they would take care of that. What happens if you need to get the patient involved? I can tell you right now, get them in the boat with you before there's ever an issue, just by opening up a little bit of a dialogue, just by saying to them, you know what, I'd really like to, I just want to know that if we have any problems with your insurance, I can work with me on these, because it is so important. It's not your insurance, it's their insurance. You know, we have a different phone call number that we dial, and they get member services, and usually they're onshore, they're in the United States, and they are usually people with a little bit more experience. So at some time or another, when you have issues with insurance companies, you really don't want to say the words, oh, I'll take care of it, you don't have to worry about it. Don't do that, because when it comes time and you need their help, they're going to say, you told me you'd take care of it, and you don't want to be there. That's not where you want to be. So we have financial agreements, which just explains that they're responsible for anything that their insurance doesn't pay. And if more information is requested from the carrier, they'll be responsible for that bill if they don't provide that information. So get their cooperation early on. A proactive patient who's involved in their own healthcare can really help you if you need it. And then that also means that you value their time, they value yours. So, when you get these patients, because what you want are patients for life, right? When you have these opportunities that they'll help you out if there's something wrong with their insurance, and you're there to support them, that's a win-win. And that's what you want, because those patients become patients forever. And there's nothing better than treating patients and their friends and their families through an entire lifetime of a practice. So bottom line, you've got to be proactive about your business. So plan for what can happen. And I've just told you a couple of things that could possibly happen and how to protect yourself if they should happen. So we got to talk a little bit about business basics. I'm just going to go over this pretty briefly, but I want you to know you don't even have to have a tax ID. You know, you could bill with your social security number. Don't do that, that's dumb, but you could. But you want to get a tax ID, and of course you want to get an NPI number. And then we'll talk a little bit about individual versus group, and then patient paperwork. So understand this. Before you submit a claim to any carrier, that carrier has to have your information in their database. Your W-9 has to be on file before the insurance company will cut you a check. And so what you want to do is you want to send W-9s out ahead of time whenever possible. And you want to keep a list of those carriers that have your W-9. So that's one of the things I teach when I go into various states. I'll provide a list of fax numbers for most of the major carriers and state-specific carriers so that you can get that W-9 out ahead of time. And the same is true when you move. When you move, you have to update any information with any carrier. So if you move, got to start the whole process all over. So you want to keep a list of what carriers have your W-9. So that, and then if you get another type of insurance that you've never billed out before, say Golden Rule out of Midwest, or another type of PPO plan that maybe it's a work comp carrier you've never billed for. Understand that before you submit those claims, try to find out how to get that W-9 because it speeds up the process. See, you'll get paid. They're not going to remind you to send a W-9. In some cases, they're not going to do anything. So keep a list of who has your W-9. And so if you get a new carrier, you can say, oh, they don't have it. I'm going to send it ahead of time. You can send it with the claim, but even better is a couple days ahead of time. So here's a W-9. And I will just give you a little tip. It has social security number and it has tax ID number. It's also called an EIN. EIN, employer identifier number, TIN, tax identification number. Don't put both. If you put both, because you're a sole prop with a social, but you got an EIN number, they may put your social security number in and process the claims that way. And your claims are going to go out with your EIN number and you're not going to get paid. So you don't put both. And you want to look, if you're an individual, check off if you're a corp or a limited liability company. So an MPI number, if you're a sole prop, you've got an individual one, right? That's another thing too. If you've moved, if you've been around and been in practice for a number of years, go check the MPI registry because it's got the first place you've ever been if you haven't updated it. Now, if you're a sole prop with employees, you're going to also get a group MPI number. It's really important because you want the pay to go to you, but you want the individual number to show who rendered the service. So if you're a sole prop with employees, you're going to get a group MPI. If you're a corporation, even if you're a corporation of one, you just incorporated, your accountant told you to, you still need a group MPI because you don't get paid. The group gets paid, the entity gets paid. So it'll have a group NPI and you'll have a group NPI and you'll put both on the claim forms. So assignment of benefits, this is very important because you should have your intake paperwork, should have an assignment of benefits that you only have to have the patient sign once for the lifetime of the patient, just keep it in its file. You shouldn't make it a separate piece of paper because it's literally one sentence. I authorize direct payments of my benefits to the undersigned acupuncturist. So it's really important if you're going to take insurance that you make sure that all your patients sign an assignment of benefits form. And you don't make a special page, just put it on your regular intake form. Now, the other one that you'll also need is an authorization to release medical information. If you don't have a patient authorize that you promise to release his information, or you request that you release his information whenever the insurance company wants to see it, they're not going to pay you. So understand, no carrier will pay a claim without a guarantee that they can access the patient's records. And what we're seeing now is we're seeing more and more carriers asking for the records, sometimes before they even pay the first claim. Again, you need to have the patient sign, I authorize release of medical records necessary to process and pay any insurance claims. And that's, again, a one-time thing in the patient's file. So, big mistake number 2 is not realizing that if an insurance carrier doesn't have your tax ID on file, you're never going to get paid. You're going to sit there and wait. And what happens is insurance pays anywhere from 10 to 14 days for your Blue Cross Blue Shield to 30 to 45 days. And so you're waiting 45 days only to find out that they didn't have your W-9 on file. And so now you send your W-9 in, and why did you wait so long for that money? See, in my mind, practice management would say the faster you get the money, the more it's worth. So what can we do to make sure you can keep the money rolling in? I'll just give you another tip too. That could be big mistake number 2.5. These are people that don't submit claims regularly. They hold on to their claims and they submit them every 2 weeks or once a week. I believe in submitting claims daily. I was on in a conference with a lady who recommended that, she told everybody in the audience, oh, I recommend you bill once a month because when you bill once a month, that's just better. I said, well, I raised my hand and said, why would you bill once a month? She goes, oh, because the doctor gets a big check and he's very happy. I said, my providers are happy with a whole bunch of little checks. So just understand too that when you do submit claims, don't hold on to them. Get them off. You know, if the W9's in the system, send the bills out. Let's get that money coming back to you. You just need to know this. This is important too. Whether or not you're an independent contractor or an employee or even work for yourself, you need to be the one picking the codes. You choose the codes for the work that you're doing. If you work for someone else, you don't let the front office choose the codes, because ultimately your documentation has got to reflect the codes that are chosen. And if it doesn't, it's the F word in my business. Now, I've seen people that work for either as an independent contractor or an employee, and they've told me, I've never seen a claim that has gone out. I go, wait a minute. They go, it's no problem, no, because the office is getting paid. I said, no, it's a big problem. Your license is on the line. Your NPI number is attached to every one of those claims. Or it should be, if you provided the service. So always have the opportunity to look at any claims that are going out on your behalf, as well as any of the explanation of benefits that come back for the work that you do. And if you work for someone else and they're not willing to do that, find somebody else. This is open and transparent. It has to be open and transparent. So big mistake number 3 is working for someone else and not having access to the claims that go out. Everything is connected to you. Your license is on the line. 2 years later, if that clinic gets audited and they say you provided the service, you're getting in the boat with them at that time, and you don't want that. So be aware that anything that reflects what you do, you've got to be able to check. So before we start creating fees, you really have to know about coding. And I just want you to know that there's office visit codes, and there's 2 types, a new patient and an existing patient. So here are the new patient codes, and we go over this in detail when I teach insurance billing for a full day. But so this is a quick overview. I'm going to tell you most of the codes would be 202s and 203s that you would use. You'll use these codes once in a 3-year period. If you treat a patient and he comes back in 2 years, and before you build out Blue Cross Blue Shield of Florida, and now he's in maybe he's had a work-related injury or he's changed insurance, you don't bill a new patient. He's still an existing patient. You have 3 years have to go by, 3 years under the bridge, then you can bill out a new patient code. It doesn't matter, the circumstances surrounding the treatment could be different. The carrier could certainly be different, but he's not a new patient to you. Just want to let you know about that. Now there's the existing patient codes. These patient codes are, this is actually not once in every 3 years should be new patient codes. These are codes that you use throughout the treatment or for a patient that comes back. Insurance companies want to see that your treatment is working, so they pay, right? I mean, if your treatment's not working, they don't want to pay. So there's something called medical necessity. How do you prove that your treatment is working? By doing another evaluation and getting benchmarks to substantially prove that the guy is getting better. If you write in your notes, patient's better, that's not good enough. But doing another evaluation and showing certain benchmarks, certain signs, increased range of motion, increased functional improvement, that shows your treatment's working. They have to pay. So be aware that you should be billing existing patient codes for patients that come back after a certain amount of time with a different condition or during the course of treatment, so you can take the time to establish that medical necessity. So the acupuncture codes, they're time-based, they're in 15-minute increment. Now, I want to go back and just talk for a second. Let's see if I can go back. I'm going to give you times next. I've given you times next to each one of these codes. You don't use time typically as a factor. You only use time when you counseling or coordination of care documents the evaluation. And I'm going to go over that in length in our class. And I will tell you, I'll be going over it again in 2021 because they've changed the E&M codes and they're going to make time a more important factor. But right now I'm going to teach it the way it is in the books, but the E&M codes underwent some updates, and those updates will be effective 2021. But we're going to stick with 2020 because that's where we are right now. So the acupuncture codes are definitely time-based. They include your typical pre and post-service work. So office visit is assumed. So you can't bill an office visit every time. And each unit of code that you bill, it has to be one or more needles. So here's the regular acupuncture codes. First 15 minutes of acupuncture is 97810. An additional 15 minutes is 97811. This is not the time they're on the table, it's the time you're face-to-face with them. So if they're on the table for an hour, but you've only spent 30 minutes with them face-to-face and you've had two sets of needle insertion, at least one or more needles, then you bill out 2 units. In some cases, we can bill out 3 units if you've spent 38 minutes face-to-face or more with a patient. And 2 to 3 is considered average. Electro codes are very similar. They're 15-minute increments. Some carriers pay a bit more for electro. We see workers' comp pay a bit more. Some pay the same. But understand that you can mix and match these codes, but there can only be one first 15 minutes. So if you start with electro, 97813, and then you come back in and you decide to take the needles out, or you want to put a needle in, you're going to stop doing electro, you're going to do regular acupuncture, you would bill that out as 97813, 97811. When the codes first came out, there's some old timers around that were told you can't mix them. And when they first came out, you couldn't. So they did a code change and now you can mix and match, but there can only be one first 15 minutes of treatment. It's either electro or regular. So here are typical modalities. Now the infrared heat lamp, 97026, it's not time-based. Because it's not time-based, you can only bill out 1 unit. For anything non-time-based, it's 1 unit. The other codes that have 15-minute increments, it is possible to bill out more than 1 unit. Now, 97124 massage, Swedish for example, this is feel-good massage. So a lot of carriers don't pay for 97124. They will pay for 97140 manual therapy techniques, which I believe would include inne and treatment like that. It's not feel-good. And that's why I don't understand. Sometimes I see billing where you billed out an hour of 97140. I said, what did you do? And they said, inne. I'm thinking, for an hour? I've had it done. It's kind of painful. I'd be a sausage if I had it. But I think what they were doing is they were billing out manual therapy while the person was getting a feel-good massage. So understand that. There is a code. There are unlisted procedure codes. I just want to make you aware of them. A lot of times you can bill out unlisted procedures, but the likelihood of getting paid is not great. And then there are therapeutic exercises for strength and endurance. And we see a lot of carriers that will pay for those codes. The 2 most popular modalities are the manual therapy and the therapeutic exercises. So we need to talk about ICD-10. We talked about CPT. Now, who owns CPT? The American Medical Association owns it. So that's why we got that wacky reinsertion of 1 or more needles when you really aren't supposed to reinsert a needle in the first place. They were trying to establish face-to-face time. But we're going to talk about the diagnosis codes. They're owned by the World Health Organization. And we're using right now ICD-10 codes, International Classification of Diseases. Now, acupuncture, when it's covered by carriers, is usually covered for pain. So you have to think about pain. The other thing you need to know is the first code is always the primary code. It's called the chief complaint. And that's the one that the insurance company will use to determine coverage. I know acupuncture is good for the whole body. It's good for anxiety, depression, insomnia, infertility. those things typically aren't covered, but pain is. So if you were to code it, in coding it, and you say, well, the person has low back pain and anxiety, and you code it as anxiety and low back pain, it's not going to be covered. But if you code it as low back pain and anxiety, you've got low back pain in the first position, you've got a good shot. As long as you have acupuncture coverage, that's typically a covered condition. So I want to talk a little bit about super bills. It's very important that if you decide, and sometimes I get people that I've taught in classes, been with them for 2 days, and after the first day they said, you talked me out of it, MorI, not going to do it. I'm going to give super bills. I'm going to collect cash at the time of service, and I'm going to give a super bill. You still have to know what you're doing. You can't give a super, I mean, you want to talk about not meeting expectations. You guys, oh, here, I'll just give you a super bill and you give it to your insurance and you can get reimbursed. But if you don't know coding, you're going to fill out that super bill wrong. You're giving the guy hope where hope doesn't exist, and he stops coming in. So just like any insurance claim, you have to understand the coding. You have to pick the codes that you did. You can't just pick one code and put the whole price on it for a new patient. You have to break it down into an E&M code and the amount of time that you spent with acupuncture, and then have a price for each thing that you do. You can be asked for additional information to reimburse a patient who's received a super bill. Some people say, I'm going to do super bills because I don't want to do documentation. First off, you're required, you're a healthcare provider. So with a license, you're going to have to do documentation. It has to be of a certain standard. And so you really need to know that you can't get out of it by just saying, I'll give the patient a super bill. This is an example of a super bill. So this is what I'm saying. You can't just circle acupuncture and put the price. You have to pick out what you did and the pricing, and then total it and charge it and give it to your patient. So you're not going to be able to get away from understanding coding or billing. Billing you might be able to get, but you're still going to have to code for what you did. And I see this being a big mistake. I really do. So to recap, whether you give cash or super bills, or you wait for your copay and wait for the reimbursement, you have to know the coding. It's your license on the line, and we want you to have those assignments in place. So verification. I can't say it enough. I can't, let's go back a bit. I can't guarantee you will be paid unless you verify. And most of them should be done with a phone call. They really should. You can't trust the patient to do it. I mean, patients think they hear what they want to hear. They hear, oh yeah, I have acupuncture benefits, when in fact they missed the part that said only in lieu of anesthesia. So verification is so important. However, if it's done right, that's how we file appeals. I win appeals based on misrepresentation. The patient, we got coverage, and insurance company, you gave it to me wrong. Therefore, it's not the patient's responsibility to pay the claim, it's your responsibility. So you just want to understand that this is so important. You also need to know that most claims go electronically. So you need some type of software so the claims can be sent through. And you usually go through a clearinghouse. Not all claims go electronically. There are still people, still carriers, third-party administrators and others that want paper claims, but the majority of them are going to go electronically. So it's important that you, if you're going to do this, you get a software and try to create claims electronically. And I'll tell you why. An electronic claim to a Blue Cross Blue Shield will get paid in 10 to 14 days. An electronic claim for Aetna, Cigna, United, it's going to take closer to 30 days. A paper claim is going to take even longer. And in fact, you're going to find they're going to say, we didn't get the paper claim. We didn't. So what happens is then you have to send it again, and maybe they didn't. Maybe in the mail it didn't work. It didn't make it to where it was supposed to be. That's why you want to send the claims electronic. You have a date stamp. They can't say they didn't get it. You see, you have a certain amount of time to submit claims. And that's what insurance companies are doing, is they're lowering the amount of time. With Cigna in network, you have 90 days. If you send that claim paper and they say they didn't get it, and you send it in the mail again, what if they didn't get it again? You've just run out of time. So you really want to submit your claims electronically, getting a software package. And now there are EHR programs that'll also submit claims. I know of quite a few of them. And it's an option for you, but just understand most claims go electronically, but not all of them do. And you got to follow up. Just like here, I said it. Some claims can take up to 10 to 14. Some claims will take up to 30, but 10 to 20 may not be processed correctly. In fact, the AMA had a whole campaign on it called Heal the Claim, because a certain percentage of claims just weren't getting paid properly. You have got to follow up on these claims. You don't have to worry about the claims that get turned around and processed and paid. It's the ones that start going south is where you have to put your attention. So you really want to do monthly reports. I like monthly reports because if you're going to set goals, you got to know how many people you saw last time so you know how to set a goal to move forward. It helps you stay focused. If you decide, you make a decision you want to go and network with a carrier, it's nice to have that data. What's really important, though, is your aging reports. Aging reports are also known as A&R reports. And these tell you, with your outstanding claims, how old are they? Because it's just like with a bill. The older the claim, the less likely you're going to get reimbursed. And at some point, if they say they don't have it, and it's been on your books for 120 days, you may have lost the ability. So you need to do aging reports. And so if you do your billing, you should create a time at the end of the month where you generate aging reports and you look what you have outstanding. That's your money. You need to look at that. If you use a billing service, all billing services should automatically give you aging reports. It's important. And that's one thing I've noticed that some billing service, I talked to a friend of mine, I run with billers because that's what I do. I'm part of the American Medical Billing Association. I asked one of my colleagues, I said, do you give aging reports? Because I've heard for the grapevine, I'd always had. She said, oh, only if they ask for them. And I'm thinking, what if they don't know to ask? So I'm telling you, ask. Now you know. So joining networks, just to understand that if you join networks, you have to submit a claim because you join the network. PPO is Preferred Provider Organizations. That's in or out of network benefits. If you don't join the network, you could give the patient a super bill. But if you're in network, you have to send a bill on behalf of the patient and you have to accept the fee schedule that you agreed to when you join the network. Now, you agreed to when you join the network. I'm going to say that twice because I have people that email me or call me and say, what am I going to do? I just got my first check back and it's for $30. I said, well, that's their fees. Didn't you look at them when you joined? I mean, that's when you want to look at these fees. You don't look at them later. So be particular about what networks you join. Can you accept that reimbursement? And if you can't, don't join the network because there's nothing you could do about it afterwards because you've agreed to accept what they're going to pay. So big mistake number 5 is joining a network without giving serious consideration to how much they're going to pay. Or also joining a network as a substitution for marketing. I have people that just getting out of school and they go, guess what? I joined every network that I could. And I said, why'd you do that? And they said, because then I'll be in the list of providers and people will find me. You drive your own bus. Nobody's driving that bus. Yeah, maybe they will, but maybe they won't. I've had people come up to me and I've said to them, I said, how you doing? They said, boy, I had more patients this month than ever. I said, really? What did you do? They said, I don't know. It just so happened. Well, guess what? If you don't know why it happened, you can't repeat it. But when you're looking at your data and you realize where they came from and what you did, marketing wise or whatever, and it worked, then you could repeat it. So understand that joining as a substitution to get your name out, it's all right. And you better hope your name starts with an A and not a Z. So just real quickly, I want to tell you, this came from data that I've collected over the years. With all things, all I want you to take away from this slide, the takeaway is all things being the same, all things being similar, a cash patient, even if your cash prices were $75 and you could expect to receive $75 from your insurance prices. An insurance patient is more valuable, not because it pays more necessarily, but that a patient is more likely to come in. So a patient would come in an average of 7 times per condition in the study that I did, versus 14 times, twice as much when he only had to make a copay. So keep that in mind. Some people want insurance patients because they say, oh, they pay so much better than cash. Well, really, they shouldn't. We'll talk about that a lot. You should have a tie to your cash prices that should be reasonable. But you should understand that when a patient doesn't have to pay out of pocket and wait to get reimbursed and can see you with a copay, they're likely to come in twice as often as a cash patient. And this is all general. This is all general terms. So I'm going to tell you, you're always going to have cash people. Anybody that's 100% insurance is never 100%. They always have an element of cash. Most people, I would say in Florida, is probably 50-50. And out of that 50, now you can't get any PI, but typically this is what I call a good balance. You could possibly exchange PI with VA, but even then we got to be careful. But the idea being you want to have a balance, because there's people right now that are heavily invested in VA, and then the VA changed the reimbursement rates and they're wondering what they're going to do. So it's kind of like a stock portfolio. Just keep in mind you want to have a good balance. So how do you decide your fees? You could call other acupuncturists in the area. You could check out Fair Health Consumer. These fees, they take directly from the claims that are submitted, so they're typically higher than what would be reasonable. You can also use Medicare rates. And Medicare rates, here's the link to that. All you have to do is Google Medicare fee schedule, and you can pull the rates for your area because they're based on locations. And most insurance companies will do a derivative of Medicare rates, anywhere 120%, 200%. So these are just ways that you can use to decide your fees. So I want to tell you, things are changing rapidly for your industry. You've probably heard of some of them. The VA changed. Medicare is now paying for low back pain, chronic low back pain. There's state laws that affect your practice. Just recently, some of the telehealth stuff that was being done, certain states couldn't provide telehealth services. There's federal laws that affect your practice, and there are entities that make decisions that affect your practice. And that's why it's so important to belong to FSOMA or your state trade association, because FSOMA, the Florida Association, is a member of the ASA, the American Society of Acupuncturists, which is the national association. And between those two, they're keeping track of things that you wouldn't have the time to. But they need your support. This is really important. And I'm going to tell you, these next couple of years are going to be, you're going to see major changes. I will tell you that the entities that I'm referring to, one of them is the AMA. It wasn't until just this year that our nation's acupuncturists had a seat in the CPT codes arena. The ASA now has a seat. I was privileged to be able to be at that meeting and get the okay that acupuncturists now have a seat at the AMA CPT code meetings. And this is important because they're making decisions that affect you. And you didn't have a seat before. And so you got codes like 97810, one or more needles with reinsertion when you don't reinsert, because they didn't know about clean needle technique. So now we do. So there's more and more things happening to your benefit, for your benefit. And that's why it's so important that I'm sure everyone on this call is a member of this association, but if you know colleagues that aren't, please spread the word, because by joining the association, you also have a direct connection with what is happening at the national level, and it's really important. So I have left, oh, perfect, exactly 15 minutes for questions. So I'm wondering if I could just look at the questions, maybe.
I can read that as well.
Okay, well, we just have 4. First one is Blue Cross Blue Shield of Florida now accepting acupuncturists as in-network providers? No, they're not. However, they will pay as if you were in-network, and they will honor assignment of benefits as if you were in a network setting, but you're considered out of network. This is a very good question, and I'll tell you why. Because in some cases, you want like a denial, or a patient has only in-network, let's say a patient only has in-network benefits, but you're not in-network. you can file what's called a gap exception and say, hey, he only has in-network benefits, but there's no network, so therefore you have to process my claims as if I was in the network. And that's really good for patients. And we see that we don't have to do it with Blue Cross Blue Shield, but we do have to do it with Aetna quite frequently. We get gap exceptions so patients can use their in-network benefits, even though there isn't necessarily a network. Should we expect that this is a great question too. Should we expect that all insurance providers to drop compensation to the new Medicare standard? No, no. No, and I'll tell you why. I see this stuff on Facebook where people say, oh, great, now there's Medicare rates. There always were Medicare rates. They just didn't use them. The CPT codes, every code in the code book gets a rate. It goes to what's called the RUC committee, and CMS, Medicare, actually is responsible for that. So the codes for acupuncture have always had prices associated with them, and insurance companies would use those prices to determine their own rates. So do I think they're going to drop to new Medicare standard? No, I don't think they are. But in some parts of the country, that would be a step up. In California, Blue Cross Blue Shield in-network providers get $41, no matter if they do 1 or 2 units. So stepping up to Medicare rates would be an advantage for that particular group. But I don't think so. You may see some that go down, but they've always had them. They've always priced it that way. Okay, if I'm in network in New York State, am I automatically in network in other states? You really want to look at your contract. But typically, there's national contracts like Aetna and Blue Cross Aetna and Cigna and United. And then there are state-specific contracts like Blue Cross, Blue Shield. So if you're in network in New York, you're in network in New York with Blue Cross Blue Shield, you're not in network with the Florida Blue Cross. You would have to do a separate in network. If you're in network in New York State with Aetna, and you also have another office in Florida, perhaps, you would have to give them 2 different addresses. You'd have to update your address. But you really want to look back at your contracts, because all contracts are different. I'm not going to say, yeah, it's a blanket statement. You'd really want to look at your contracts. With the national carriers like Aetna and Cigna and United, it should be as simple as adding an address, another facility address, and you'd keep the pay-to address the same. What is the process of getting an MPI number? Just Google MPI registry. They'll walk you right through it. Simplest thing in the world. Someone said, do you have names for good electronic claims filing software? Yeah, well, there's semi-free, which is PracticeMate. PracticeMate is part of Office Ally. And if you're just doing claim submission, you could do a simple claim submission. When I teach people who are brand new to this, I tell them to start with Office Ally, which is a clearinghouse, and just fill out an individual claim itself. Claims, just, a simple claim, and send it in just to get used to practicing it. Then you can switch to PracticeMate, their proprietary software, and use that. There's a number of EMR softwares now, Jane, Unified Practice, and others that also have the ability to submit claims to Office Ally. Okay, the next question, can I be in the network for another field and out? Yes, you can. Yes, some people are dual licensed, and just because you're in network as an acupuncturist and you're also a chiropractor doesn't automatically give you chiropractic in network status. Oh, hi, Michelle. NYSHIP is now with Optum effective 7/1. Do you know if they are going to eliminate out-of-network benefits? Michelle's actually in New York. So she's asking me a question because Optum had stated they were going to eliminate out-of-network benefits. I can't say for sure. I'm going to answer it. I can't say for sure. I will tell you that NYSHIP is self-funded, so so they can't make decisions for a self-funded plan. And I have a letter out to Optum to ask for clarification about that. They can only say we're in network only for plans that they sell. They can't make that decision for a plan that they administer. So I can't say for sure if they're eliminating all out-of-network benefits. Time will tell. And if I can get an answer, I'll get it to the Florida State Association and to you, Michelle, and we'll disseminate it. What was the code for therapeutic exercise? 97110. I could not copy the Medicare link. Can you put it in the chat? I can't put it in the chat, but I'm going to tell you, if you just right now Google Medicare CMS Medicare fee schedule, and it will come up, because that's how I got it. What are the details for the course you teach on insurance billing? I need to learn about this from the beginning. Yes, we will start from the beginning, and everything that I talked about today, we're just going to like expand on it. we're going to give you, I have people that don't know what a deductible is. So I teach people what a deductible is and what the difference between a copay and a coinsurance. We're going to go over all that when I teach the beginning class in July. Okay, someone asked, would you please repeat the importance of having two MPI numbers, business name and personal name? Well, the importance is if you, how do you want the check made out? If you have a corporation, if you're a DBA, if you're sole prop doing a DBA, you really only need one MPI because you're going to get paid. But it's important if you have mostly if you have a corporation, or if you have other people that you're going to be working for, you're going to get reimbursement for the work that they did. That's why you need a second MPI. So it's not just their MPI number individual, it's the pay to who's going to get paid. ABC Acupuncture is going to get paid. ABC Acupuncture should have a group NPI. Someone here is asking if I have a cash patient that bought a package. I'm not going to talk about packages. I'm sorry, but that's outside. I'm not a subject matter expert in insurance packages. What fee should I put on the super bill? I imagine you would put, if they paid, you put the $88, but I think that's a question. Any packages you should run through your state, not your state association, but the actual acupuncture board. What do you think of Optum and Availity? Well, Optum is the carrier for United Healthcare, and now they have the contract for some of the VA. I have no problem with Optum. I think Optum's fine. Availity is a website that you use you can submit claims through it. I've never done that. But Availity is where you look and you can check out the status of claims that have been sent and processed. We use them both. I like them both. We don't have any problems. Availity for verifications, not so much, because it doesn't give enough information. Do you know if the VA is still paying for acupuncture providers that exceed a certain distance from the VA but have a local? All I know is if you get an authorization, you're going to get paid. So I don't know what distance has to do with it, but I do know that the VA, you don't treat a patient without an auth. And so that auth is typically because the patient is too far away or they can't get treatment. I use Office Ally and it's free. Yeah, it's free. However, if you have a certain number of claims, they're going to charge you $35 an MPI number if you have a certain number of claims. So I always liked it. I always promoted Office Ally, but I don't promote it as actually free. What is the rule for cash rates when you're taking insurance? We're going to talk about that in great detail on Saturday, but basically you want to have a tie between your time of service rates and your cash and your insurance prices. And so most people think, what is the cost savings? If I have to submit a bill, I got to submit a bill, I got to have software, I got to have somebody do it, I've got to process the payment, versus cash, I just swipe a card and take the money. So what is that savings? It's thought to be anywhere from 10 to 15 to 20%. But your cash prices shouldn't be 125 and your insurance prices be 200 or 300. There's no connection between those two. Is the VA in Florida through Optum going to reduce compensation to acupuncture to Medicare rates? Yes. All VA will. Optum's going to do it effective 9/1. Tri-West already started doing it. Do you recommend a particular clearinghouse to work with the VA? No, I think any clearinghouse. I recommend Office Ally as a clearinghouse. They're the number one I recommend. There's others, but they're typically much more expensive. Do you know if we can still receive our VA contract rate from last year and then slowly, no, I know you were. I know people have lost a lot of money when they started applying the Medicare rates, but I'm gonna tell you that no, it's gonna be the Medicare rates. Now, what hasn't changed are the rates for the modalities that you do. Let's see, are HICFA forms still used? Yep, yep, it's called a CMS 1500. They don't call it a HICFA anymore, I believe. I think a copy of the webinar, I think it's going to be on YouTube. So, right, Natalia, it's going to be on YouTube and on the website.
This webinar is being recorded and we will upload it to our YouTube channel by the end of the day tomorrow. So all of you will have the ability to rewatch it and enjoy it.
Hopefully. So is office out? Yes. Okay. You may have answered this. Why does Primera only pay for 2 units of acupuncture now? That's all they haven't. Primera reduced to 2 units a long time ago, and we're working on that with WIAMA, because typically it's 2 and 3, but Primera has always been 2 for the longest time, maybe 10 years or more. When is the course on Saturday? I'll let Natalia talk about the course on Saturday. And are we still able to submit claims for telehealth? Yes, yes, you are. In fact, I have a free telehealth seminar. If you go to my website, MorIWestSeminars.com, there's a free, it's over an hour seminar just on telehealth. And I'm going to tell you, you're going to see more and more telehealth being allowed. It's not going to go away. And I don't know how big of a part you'll play once COVID is over, but telehealth is here to stay, guaranteed. So, okay, I'm going to turn it back over to Natalia now.
Thank you, MorI. Thank you, everyone. So I'm just typing in the chat box, MorIWestSeminars.com, so you all can check it out and enjoy that free telehealth webinar. So with your webinar question for the 18th and 19th, I did want to go ahead and share my screen with you and just show you all how to do it. So you would just go on to our FSOMA website, FSOMA.org, go to our calendar icon, and then you're going to go to July. And on the 18th, we have beginning insurance billing. And on the 19th, it's bulletproof exams and documentations. Now, we do recommend you take both of these classes together, take the full weekend. If you can and you're only available one day, that's fine. I'm sure that we'll have MorI back with us and we'll be able to do this again. So if you click on either or, I'll give you a brief overview of what to expect in the class. And if you're a FSOMA member, you can enjoy the single day class for $100 or the full weekend for $180. If you're not a FSOMA member, it is $300 for the whole weekend and $180 for 1 day. So then you would click on register today. And if you don't have an account with us, it's okay. It'll prompt you to open an account. There is my cell phone and email. Please don't call me. And you would, so I have a membership, right? So it's showing me my member prices. I'm a NCCOM diplomat. You do get CEUs for the bulletproof examination. You would fill it out, and then you have the option of filling out, choosing either the single day or both days. And then you would submit your form. And that's how you would be registered. And there's a lot of really good perks in regards to taking this weekend webinar, because one of them is that MorI makes herself accessible to all of you about a week after the webinar. Because of course, this is such a an important subject matter, and it has a lot of ins and outs. And so that's the great thing about taking this class and learning from MorI, is that she's just a resource for you after the weekend as well. And let me see, we do have 3 more questions that did come in, which are not related to insurance. So yes, if you have any more insurance questions before we close, type them in now. And thank you, MorI, for being here with us and sharing your time with us. This has been very valuable. And even for me, I've been billing insurance, not on my own. I do hire someone, and there's a lot of really great information that I didn't know about that you shared. So that was really,
Good.
yeah.
It's all about empowering. You don't learn this in school. I mean, you might get a smattering of it, but you really have to be proactive to really want to learn this on your own. So I really appreciate anybody that wants to take the time to do that, because not only do they want to learn how to do it, they want to learn how to do it right.
Yes.
So I really appreciate that. So, well, I'm looking forward to seeing you guys all in July. So.
Yes, and thank you everyone for being here. Thank you again, MorI, for your time. And thank you everyone for supporting FSOMA. If you're not a Florida acupuncturist, please support your state association. They may not be perfect, none of us are, but together in collaboration, we can achieve so much more.
True.
So thank you everyone, and thank you, MorI. Have a good night.
Good night.
Night.